So thanks for the opportunity to speak today. I have to start by saying that I would say that sexual pleasure is not really, I guess, my main area of work. But I think like a lot of you, it's something that comes into our work all the time, and we do often think about this concept. So in the last couple of weeks, I've done a lot of reading on this topic to make sure that I'm really informed to give this talk, and I hope there'll be something useful for everybody. And there are my disclosures. So why are we talking about sexual pleasure, particularly at a forum about stigma? And I really think the first question that we need to be thinking about is, why do people have sex? This is what it really comes down to. Why do we have sex? And the key insight that comes from all the reading that I've done over the last few weeks and all my work for the last 20 years is that despite sexual pleasure being a major motivation for why we have sex, it's mostly absent from sexual health, HIV research, programs, and services. The fields of sexual health, reproductive health, and HIV typically take a deficit-focused, risk-based approach, focusing on negative health outcomes. But people don't have sex to avoid risk. They have sex for positive reasons, including to seek out pleasure. Indeed, sex itself is often missing from our work, whether that's clinical work, research work, or service provision or health promotion. Here's a quote from one of the leading researchers in this field, Anne Philpott, earlier this year, who said, "I went to my first International AIDS conference and I thought that if a Martian had landed at this conference, they would think that HIV is an airborne disease. Pleasure and sex were completely absent." And indeed, the Pleasure Project that Anne co-founded actually analyses all the abstracts that are presented at International AIDS Society conferences. And they found that out of nearly 70,000 abstracts, only 352 mentioned pleasure at all, and of those, only 31 mentioned pleasure in a positive way. The rest of them almost mention it in a negative way, sort of like a pleasure but. So what is sexual pleasure? What are we really talking about? This is the primary definition that's used around the world by the Global Advisory Body for Sexual Health and Wellbeing, and this was from 2016. So sexual pleasure is the physical and or psychological satisfaction and enjoyment derived from either solitary or shared erotic experiences. And importantly, there are several enablers of sexual pleasure, including self-determination, consent, safety, privacy, confidence, and the ability to communicate and negotiate sexual relations. Also importantly, in this definition of sexual pleasure, sexual rights are given a lot of prominence. So conceptually and empirically, sexual pleasure is not as well defined as many of the other concepts that we think about in our day-to-day work, particularly in public health. So in this presentation, I'm using a broad definition of sexual pleasure. It's going to be, I'll use it to mean physical sensation, intimacy or emotional closeness, fun, joy and excitement, feelings of sexual freedom, liberation, reduced anxiety and worry about HIV and sex, and sexual satisfaction and well-being. And I want to point out on this slide that even as far back for almost 2 decades now, the World Health Organization, which is not known to be a particularly radical organization, has included sexual pleasure as a core component of the definition of sexual health. So sexual health is a positive thing. It's not just the absence of disease, dysfunction or infirmity, and they recognise that sexual pleasure is key to that. And I also mentioned there again that thing about sexual rights. So what does the research say about sexual pleasure? So I haven't shown the citations here, but various research studies have found that sexual pleasure, broadly defined, can have positive impacts on mental health, on physical health, for example, cardiac health or prostate health, communication and consent, and also working through trauma. But to get a bit more focused on sexual health, one of the key insights that have come out, or key pieces of research that have happened over the last few years, is this systematic review that was published in 2022, which looked at the added value of incorporating sexual pleasure into sexual health interventions. It reviewed 33 unique interventions involving over 18,000 individuals, and it included as part of this a meta-analysis of 8 interventions focusing just on condom use. And it was concluded from this systematic review and meta-analysis that incorporating sexual pleasure into sexual health interventions can improve condom use, knowledge and attitudes, and also behavioural skills. So this is a public health argument. Including sexual pleasure into our work, into our interventions, improves the efficacy of those interventions. So more specifically on HIV, prior to the biomedical prevention shift starting in the 2010s, research into pleasure in HIV really focused on condom use. And one of the key things that they did a lot of in the 2000s was trying to eroticize condom use. So try to make condoms fun and sexy. Kind of seems a bit quaint now in the biomedical era. But a lot of work focused on that. And they were basically the studies that were included in the systematic review that I just mentioned. There is a body of research, a growing body, that is on HIV treatment as prevention, and U equals U. And this work typically focuses on serodifferent couples, and it often has a focus on intimacy within those couples rather than specifically sexual pleasure. It has demonstrated that U equals U can increase confidence, can reduce anxiety, and it can increase intimacy. But a much larger body of research that's grown more recently is focused on PrEP. And I'm just going to talk about a couple of different reviews that have been published in the last few years. So the first of these, by Kirby and colleagues, is a systematic review of 16 quantitative, qualitative and mixed methods studies, and most of these, it has to be said, focus on gay and bisexual men. And PrEP has been found to be associated with increased intimacy in both couples and casual contexts, increased sexual options and freedom, sense of freedom and liberation, removing barriers to physical closeness, decreasing sexual anxieties, and increasing feelings of control over the types of pleasure that people might want to experience. A really key point from all this research is that it's found that for at least some people, and I would actually say probably most people, the link between pleasure and PrEP really comes because PrEP means that you don't have to use condoms as much or at all. And I think that's really important for us to face head on. I know that that's a bit controversial. Some people still think that you must also always tell your patients or clients, even if you're on PrEP, you should always use condoms. But it's important to remember that PrEP is designed to prevent HIV. It's not designed to prevent STIs or those other things. So it's focused on HIV, reducing HIV incidence. So a lot of these people in these studies were saying, the reason why PrEP increases pleasure is because I don't have to use condoms. However, for some, PrEP can have positive effects that are independent of condom use. So for some people, they might still use condoms when they're on PrEP, and it can still increase their feelings of pleasure or reduced anxiety or so on. A really key insight from this work is the existence of a positive feedback loop between PrEP and pleasure. So pleasure, broadly defined, can be a motivator for people to go on PrEP, but then PrEP can also increase the different kinds of pleasure that I've measured, which then thereby links back and feeds back into the motivation to continue on PrEP. And I think this can also be true for HIV treatment and U equals U. So the second review is a large narrative review of research into how PrEP has changed sex for three populations: gay and bisexual men, trans people, and cisgender women. They did try to look for research on cisgender heterosexual men, but there wasn't enough to include in the reviews. That's a clear gap in the research. And again, very similarly, PrEP was found to be associated with enhanced sexual self-esteem, increased sexual satisfaction, improved sexual pleasure, reduced sexual anxiety and mental health symptoms, increased sexual agency and control, increased intimacy, the reduced need for condoms, as I mentioned before, which can act as a barrier to sexual satisfaction, and increased comfort in having sex with serodifferent partners, and the prospect of potentially reducing HIV stigma. We have seen some evidence that PrEP coming into the community has increased HIV stigma, but it hasn't taken it all the way. There's still a lot more work to do. So what are some of my brief reflections on this research? Almost all of the pleasure-focused research has been conducted in Western countries. I think that needs to be said outright. There's almost no studies that I could find that are situated in the Asia-Pacific region. Most research has focused on populations that are considered at high risk for HIV, particularly gay and bisexual men, rather than being focused on all populations, including cisgender women. And there are increasing bodies of work on sexual pleasure in two sort of main areas: the sexual and reproductive health and rights field, and then the PrEP field. And these two fields, from what I can see, aren't really talking to each other very well. So I think there's insights that are happening around increasing how to use sexual pleasure in our work in both of these two different areas, but they're not really talking to each other and learning from each other. And pleasure, as I said, has not been a major focus of U equals U related research. If it's included, it tends to focus on intimacy specifically within couples rather than being broader. And I think this says something about HIV stigma even within our own field. So when we're talking about negative people on PrEP, we can talk about fun and sex and excitement and pleasure, but when we're talking about people living with HIV and treatment, we have to talk about intimacy within couples. Seems a bit contradictory. So the big question I was asked to talk about today is how can we destigmatize sexual pleasure? I hate to disappoint you, but I'm not going to give you an answer. I'm hopefully going to talk a little bit more about how we can use it. There certainly is a lot of research over more than 2 decades that has established that sexual pleasure is stigmatized. And it's stigmatized in similar ways and for some of the similar reasons as the other kinds of stigma that we routinely discuss in this field. So this idea of erotophobia or stigma against sexual pleasure is an intersecting form of stigma that intersects with HIV stigma, homophobia, biphobia, transphobia, sex work discrimination, slut shaming, and so on. All are heavily shaped by cis heteronormativity, patriarchy, sexual moralism, and so on. And all of these are currently being turbocharged by increasing levels of authoritarianism and religious popularism that are occurring in many countries around the world, including the US, but also in the Asia Pacific. So even when sexual pleasure is included in research and services, it can be downplayed or hidden. It's rare that you're going to find someone writing to an authoritative research body, for example, for funding, saying, I want to run a big study on sexual pleasure for public health reasons. It might be in there, but it's often hidden. And what this does is it can actually help to perpetuate the stigma. It can make it seem like no one's doing this work or no one's talking about this work, when in fact maybe they are. Unfortunately, there is very little research or even insights on how to address stigma against pleasure. And this is really similar to where the field is currently at with the other kinds of stigma that we talk about, including HIV stigma. There's a lot of description of the problem, and there's not a lot of clarity about how we go about addressing it. So as with any form of entrenched stigma, it's going to be difficult to address. But I just think, and this is from me, not from all the writings that I've read over the last couple of weeks, is that one of the most useful things that we can probably do is just use and try to normalise the concept of sexual pleasure in multiple aspects of our work, and I'm just going to talk about a few of them in my last few minutes. So starting at the big level, policy, law and advocacy, how could we incorporate sexual pleasure? So just again, I want to reiterate that sexual pleasure is not some out there radical fringe idea that's coming out of nowhere. This has been accepted as an integral part of the very definition of sexual health by normative organisations, indeed conservative organisations, like the World Health Organization for over 2 decades. So why are we still not able to talk about this openly and clearly? In some contexts, linking sexual pleasure to sexual rights has been useful, particularly in high-level policy. So a lot of work has gone on to link the sexual and reproductive health agenda in, for example, the Sustainable Development Goals at the global level, and try to incorporate sexual pleasure into those. But it has to be recognised that this isn't going to work everywhere, and I think a lot of you would probably feel this about your own countries. In many contexts, advocating for sexual rights is not going to be practical because of the stigma that exists. A lot of governments aren't going to care about the idea of sexual rights. So it may be more useful in some contexts to focus on public health. That is, the argument or the evidence that incorporating sexual pleasure into programs and services actually does lead to better outcomes. It works. So why are we not doing more of it? And I think it's important to understand that all of these different types of stigma that we face really do have the same root causes. I listed some of them earlier. And so if we can see all of this as being part of the same fight, then I think what that can potentially lead to is perhaps a more effective advocacy. If we can see that when gay men are arguing for less HIV stigma, it's actually the same underlying fight that they're having when women are arguing for access to contraception and abortion. How do we incorporate pleasure into research? So research is increasing on the role that sexual pleasure plays in sexual health and HIV, but there are many gaps and there's a lot more to do. Here are some of the things that we can do. We do need better technical definitions of pleasure and all the related concepts. This is to improve the empirical rigour and hopefully then the impact of the evidence. We need a better description of how sexual pleasure is actually incorporated into interventions. So in that systematic review I mentioned, they really found that there wasn't a lot of description of how the interventions actually use sexual pleasure. Also, one thing that needs a lot more work is to understand the mechanisms of how sexual pleasure improves sexual health and HIV outcomes. So while that systematic review showed that interventions that include sexual pleasure do better than the controls, it wasn't really clear why. Is it because of the sexual pleasure inclusion, or is it because of something else? So more research has need to be done there. I think we can all include more sexual pleasure work into our empirical studies, both as a factor associated with other sexual health outcomes, but also in its own right. And as I mentioned before, there's less research on U equals U and reproductive health compared to PrEP. So I think doing a bit of that could be helpful too. So what about health promotion? First, we should note that very few HIV education campaigns globally have really explicitly focused on sexual pleasure. And again, we can understand why. It's because of stigma. It's hard to do, particularly if it's public. But I would argue that PrEP and U equals U offer a unique opportunity to utilise pleasure, both as a consequence of both and as a motivator to start or stay on PrEP or ART, because PrEP and U equals U allow condomless sex that is safe from HIV transmission. However, it does need to be said that even in largely sex-positive settings where HIV education campaigns are largely positively framed, and Australia is a good example of that, it can still be politically risky to conduct large-scale health promotion focusing on sexual pleasure. I can't imagine even in Sydney, the middle of Sydney, putting bus shelter campaigns where it talks about pleasure rather than health. It's easier for campaigns such as on PrEP to focus on things like empowerment, control, or reduced HIV anxiety than really going out there with the idea of pleasure. So I totally get that. But at the same time, we can do targeted social marketing that can typically be more risque, more pleasure-focused and more sexually explicit. So by that, what I mean is, for example, in Sydney, when we do posters that go up in sex on premises venues or saunas, they can be quite pleasure-focused. Or if you do an ad campaign that's on Grindr rather than on Facebook, you can make it a lot more pleasure-focused. And what about service delivery? So research has shown that many populations at risk of HIV and STIs are interested in discussing sexual pleasure in healthcare settings. I was actually surprised to see that finding, but it's been found in a couple of places. Healthcare workers are generally not trained in this and often lack confidence to talk about things like sexual pleasure and the positive aspects of sex. But this is actually a good point that I found. The training of sexual healthcare providers is one area where there's actually already a lot of resources out there. I really encourage everyone to look at particularly the first link on this page, which is from the Global Advisory Body on Sexual Health and Wellbeing. They have entire training courses just there for you to download, and you can actually just run them. So I really think this is more about a lot of resources are actually already out there. They just need to be put into practice with more service providers and in more settings. Also, the Pleasure Project website has a lot of resources there as well. So given that stigma can prevent the public discussion of pleasure, one-on-one clinical encounters offer a really useful opportunity to incorporate sexual pleasure into HIV and sexual health care. There are obvious barriers. We've talked about some of them before, but another one is limited time in consultations. Often what a doctor or a clinician wants to do is just focus in on what they're there to really cover, and they don't feel like they don't have time to waste on frivolous things. But I think we need to understand that sexual pleasure is not frivolous. It's actually core to sexual health. And peer-based key population-led services may be even more uniquely positioned to incorporate sexual pleasure appropriately and sensitively, because then you have peers talking to peers. This is just one little example from that training program that I mentioned before by the Global Advisory Body about sexual history taking. So this is how a clinician might typically do it. It's very focused on risk, number of tests, sexual partners, kind of looking at the risk factors, STIs, looking at sex work. And what they've done is come up with a new tool that they've called the pleasure meter, which is just a different way of doing a sexual history. It shouldn't take too much longer. It might take a little bit longer than that really more quick and dirt, like the quick way. But what this way does is it allows people to talk about a whole range of positive elements of their sexuality and their sex life, while still allowing those issues of HIV risk, STI risk, and so on to come up naturally through the course of the conversation. So this is just a little taster. Go onto the website and have a look at that. It is really interesting. So I'll just finish in my last minute with a few concluding remarks. So sexual pleasure is a primary motivator of sexual behaviour for all of us, but it is largely absent from HIV, sexual health and reproductive health programs, services and research. For HIV prevention, including PrEP and U equals U to succeed, we need to engage with the reasons that people have sex, not just the risks. Research demonstrates that incorporating sexual pleasure into programs and services improves sexual health outcomes and can create positive feedback loops, so it can be helpful. We do have to acknowledge that sexual pleasure is stigmatised, and our field does take a deficit and risk-based approach to HIV and sexual health. But we can find appropriate ways to use and normalise sexual pleasure in advocacy, research, health promotion and service delivery. And as I said a couple of times, I really do think that PrEP and U=U offer unique opportunities to incorporate pleasure into our work. So thank you very much for your time. I hope that's been useful and I look forward to the discussion.